it takes at least 3 months is what we're told for each medication to see if it works. And 3 months may not seem like a long time to a physician when you're seeing us every 3 months, but 3 months with carrying on with these issues is a really long time.
Welcome to the Learn Skin podcast with me, Dr. Raja.
And me, Dr. Hadar, where we discuss all things skin.
Join us as we delve into the art and science of skin health in today's episode.
Hey, Raja, can you say the thing I told you to tell them?
Of course. We are board-certified dermatologists. This podcast is meant for educational and informational purposes only and is not considered medical advice, nor does it serve as a substitute for professional care by a doctor or other qualified medical professional. All opinions shared do not express the views of Learn Health, Inc. Let's get to the good stuff.
Hey, Raja, how are you today?
Hey, Hadar. You know, I've been thinking, we always talk about all these other things that we like to do, but, you know, there's an area of passion that has been really close to you, right? You do a lot of surgeries, and there's this one disease that's now emerging, and I think that's what we're talking about today, right?
Yes, we're talking about a topic that's near and dear to my heart. Well, actually, two topics that are near and dear to my heart. One is Hidradenitis Suppurativa. People call it for short HS. You may hear about the disease as HS, so we'll just refer to it as HS, but that's the full name. And the other thing that's near and dear to my heart are my patients. And, you know, it takes a special person to kind of carry the burden of this disease, but it takes an even more special person to step outside of their own kind of bubble and take leadership and say, I can advocate for others. And there's a few of them, but we have one with us today.
Yes, we do. And, you know, Hadar, I heard you were about to say specialer, and I like that, even if it's not a term. If we can make up some terms here on the Learn Skin podcast, let's do it. So we have Brindley Brooks with us, who herself has struggled with HS, and she's going to tell us a little bit about her journey. But what's even more interesting is that she's the founder of HS Connect, that really gives a voice to a condition that has not had a voice for a long time. In fact, it had been misdiagnosed for a long time, maybe even a source of shame. So Brindley, let's get on the right path about this condition, and thank you for joining us on the podcast.
Hi, gentlemen. Thank you so much for having me. I really appreciate the opportunity.
Excellent. And really, I think maybe we should start in the beginning with your journey, because I think there's a lot to learn from the process you went through, which is unique to you, but also so common to others. I mean, I'm sure as you talk to others, you find their journey kind of mirrors in yours and vice versa, right?
Yes, absolutely. I've had HS since I was between 10 and 11. Started presenting in my groin and my underarms. And my mom took me to our general practitioner. And he, at that point, had no idea, which was 27 years ago, no idea what was going on. And so they were continually lancing what they were calling just boils at that point. I ended up finally seeking dermatologic care, and that worked out. I ended up following the same kind of line that most people go. It took me about 7 years to actually get a diagnosis. I was finally diagnosed. Yes.
7 years. I mean,
Yep.
I don't want to interrupt here. I just want to point this out. 7 years in your formative parts of your life where someone was kept calling it a boil. Yeah, please go ahead. But I just want to emphasize, man, this is not, I mean, it's a huge delay to diagnosis for this condition.
It absolutely is. And this is really common for HS. It's an actual 7 to 10 year diagnosis delay for people with HS, which is a huge, like you said, it's during all of your formative years. During middle school and high school, I'm going to school with issues in my groin and trying not to let anyone know about this because it's embarrassing and I don't know exactly what's going on. So it was horrific. And it was horrific for my mom as well, because she was doing what she could to help me, but had no idea and wasn't really getting any answers from physicians about what was going on either. So it's embarrassing when you're in high school or middle school that you have to sit out during PE because you can't run or do the mile or whatever with the rest of your class. People are constantly asking you what's wrong, and you're embarrassed and full of shame about telling them. No one wants to talk about drainage in their personal areas. I mean, it's not cute. You know, you have abscesses that rupture when you're at school. You have to go home because you need to change your clothes. You're one of the only people who carries kind of like a kit, an emergency kit, so to speak, in your backpack. You're the kid who has to have special restroom privileges to go when you need to because you may have an abscess that needs to be tended to during the middle of school. So it's extremely difficult to be a middle schooler, for instance, with this disease. it's definitely difficult. I ended up finally being diagnosed at 16. I was put on vitamin A derivative medication, and that was an absolutely horrific experience for me personally. I then kind of didn't feel like there was much that was in the way of help available. Like most people feel the same way when they're seeking care. We're kind of told that the treatment options are limited. So you kind of lose a little bit of hope after you do a couple of them. The other problem that most of us with HS run into is that it takes at least 3 months, is what we're told, for each medication to see if it works. And 3 months may not seem like a long time to a physician when you're seeing us every 3 months, but 3 months with carrying on with these issues is a really long time. So even to try treatments, you're looking at, 6 months to a year just for trial to see if it even has any impact. So that's a really long time, and something that we're hoping will change as we get more treatment options available as well. So I ended up basically just kind of going it alone for the majority of my life with my HS. I didn't really seek dermatologic care. I went for probably about 10 or 15 years without seeing anybody for my HS, because the last time I had been told there wasn't much else that they could do. So at one point during my life, I had no idea what it was called. I knew it had an acronym, couldn't remember. I didn't want to allow it to control me, so I kind of just tried to forget about it as much as I could, which of course it doesn't allow me to forget about it. But I tried to take the position of I was going to manage what I could instead of it managing me. So I would do my daily routine with washes and all kinds of things. You would get flare-ups whenever they decided to rear their ugly head, manage those as they come up, and carry on with life. I've worked full-time since I graduated high school. Most of the people I worked with before I had my surgeries had no idea I was dealing with this. So as a person with HS, you can carry this burden by yourself. I didn't tell hardly anybody about this until I had surgery a couple of years ago. So my boss that I work with, I've worked with her for over 15 or almost 20 years, had no idea I had this disease until I went to the surgeon and ended up having wide excisions and had to be out of work for 3 months to heal. So it's amazing what a secret and how much you can hide this, because it does tend to affect some of the most personal areas. So it's not something that you have to shout from the rooftops, but at the same time, that's a really heavy burden to carry. So I ended up finding a dermatologist here after I finally decided to seek care. And I did that because I saw a commercial for a biologic and was like, oh, okay, maybe there's something new out here that I can give a try. I tried it. Unfortunately, it didn't work for me. It has great success for many others, so I wouldn't dissuade anyone from giving it a shot. And I ended up seeing a dermatologist at the University of Washington, and she looked at me and said, I think that you're a candidate for surgery. At that point, there was no way I could have surgery. I'm a mom. I work full time. I've never taken time off for my HS, even when I probably actually should have. And at that point, I was dealing with a golf ball size flare underneath my left breast. And it was so painful that I was wearing 3 bras to try to keep my breast from touching it, because when I would, it would just absolutely take my breath away. So when I went to see the surgeon, he looked at me and is the first person who actually said, I can help you. I had heart eyes when I left that office. I had signed the consent form and I was scheduled for surgery the next week. So I kind of caught my boss off guard, obviously, having known me for so many years and having no idea that I even had HS. And all of a sudden I now need to take off 3 months, from my job, and I'm the only person who does my job. So that kind of caught her off guard. But it was the first time that I have ever been given permission to take care of myself and to put myself first. And I thank my husband and my mom for that, honestly, because without the support of both of them giving me the right to put myself first and to do something that could potentially better me for myself, my kids, my husband, my family, I would never have done it. And it has been the most life-altering thing I have ever done. I went, 25 years without telling anyone I had HS to now being the founder of HS Connect. I learned more and more about HS after I had surgery and joined HS support groups online. And that's actually how I met my co-founder. I was having issues with bandages sticking after my surgery and went online and was asking if anybody had advice on how to help, take the bandages off without them being stuck in the wounds. And she ended up sending me a video of her removing bandages. And then we just started talking from there. And that's how HS Connect ended up being born. We worked on a couple of projects together and then decided there really was a need for what we were doing. And we were both very passionate about it. So I went from not even remembering what the name of the disease was for 10 years to now I spell it in my sleep.
Wow.
And so it's been quite the journey. I really want to focus on helping people take control of their disease as much as they can. We don't have very many options, so it becomes difficult. But at the same time, I feel like I am the person that I am in part due to my HS, my resilience, the fact that I want to help other people. All of these things came as a result of that. So for me, it's not a negative thing. It really has been a positive thing in my life.
Well, Brindley, I have a question for you. First of all, thank you for taking us through that entire journey. I mean, I know, we're like maybe a few minutes here where you're trying to summarize probably, many months, if not years of frustration. I mean, clearly years of frustration, but, just being in this flared state and then finally finding a way to even get a handle. And then, I really appreciate you doing what you're doing with the HS Connect. We'll come back to that. But I wanted to ask you some questions that are maybe the tough ones that physicians struggle with trying to address. But if you don't mind, I'd like to pose them here because it might give our listeners a better idea of how to approach certain conversation topics in the clinic. And so,
yeah, absolutely.
Yeah. And the first one that comes up is really around, the fact that the impact of nutrition and perhaps body weight. And there's a two-way street here because, right, if you're in pain, how the heck are you supposed to exercise? And then the physicians, sometimes what happens is they forget that there's a struggle here and they just minimize it. And then they say, oh, you just have to lose weight. So my question to you is, how should, if you could give advice to physicians, PAs, NPs, practitioners, what is the best way to approach this concept of nutrition and weight? Because especially on Learn Skin, we want to be integrative, but we also don't want to be offensive inadvertently. So what are your thoughts there?
I think that's a really good question, and it's a difficult one. And I know, a lot of people follow in the same footsteps I have, which I've been told you just need to lose weight and it'll be fine. I actually underwent weight loss surgery and I lost almost 100 pounds and it had zero impact on my HS. I think weight is not an issue for everyone. I think everyone is different. And I think most of the problem with HS is that in some cases, it's not explained to people the difference between skin folds and how the microbiome is different in a skin fold and why that may be where your HS likes to park itself, I like to say, as opposed to just carrying some extra weight. So it's a really tough thing. Of course,
that's a great point.
Yeah. And of course, losing weight is good for your overall general health, right? We all know that. But right. I think that some of the issue that comes with that is that the depression and the psychosocial impacts of HS are also really counterintuitive to good nutrition and weight loss. It is uncomfortable to exercise. You cannot go for a walk when you have a huge flare between your thighs. It's just not feasible. So when someone says to you as a patient, well, you just need to lose weight, but offers you no assistance in how you can do that, it's very discouraging. And the same thing with nutrition. Food is not a trigger for everyone. And we fight this daily on social media where everyone's like, do the AIP diet, do this. But that may have worked for one and it doesn't work for all. And that's one of the really difficult things.
Thank you so much for mentioning this.
It's one of the most difficult things about HS is it impacts everyone differently. It also, in each area of your body, possibly. Food isn't a trigger for everyone. Clothing isn't a trigger for everyone. It does not act the same, or not everyone has the same triggers. So nutrition is another issue where I feel like people aren't really given the support or given a direction that they could head in. So for some people, food is a trigger. And for those people, I'm jealous that you can figure out what that trigger is. How to do an elimination diet. People aren't taught how to do that properly. So it becomes extremely overwhelming and you just give up. So I think a lot of that has to do with some of the depression and the anxiety that people can feel and just the overwhelm in a general sense anyway of having this condition and how much of your life is consumed by it. And then when someone asks you to do something to change what you're doing and you feel like you're kind of just barely making it anyway, it can feel very, very overwhelming.
First of all, Brindley, I really appreciate you bringing some of these things up because I think it's a challenge to bring this up in the clinic. And, one of the approaches that I've even taken, and I'm learning from you here, is just to acknowledge that it's a challenge. I think just acknowledging that it's a challenge to exercise or acknowledging that the psychosocial impact that's there I feel like opens up conversation where it becomes a little bit more nascent. I wanted to make the comment on food allergies. They have these food allergy tests that are out there, IgG, IgA, IgE. Nothing has been proven by evidence to actually say if you take those tests and you eliminate those foods, that your HS is going to go away. I just want to make it really clear on this podcast because I'm sure a lot of people are going to say, oh, food allergies or food testing, maybe we just do the food test. We need companies to come out and do studies with HS, and we're trying to push for them. And Brindley, maybe we can pull you into these kind of studies just so that, you know, we can get that patient perspective. But right now, there are no studies on this. And I mean, Hadar, I don't know if you have any comments on this, but we just have to be careful not to think that, you know, these food tests that are available are going to give us a solution to HS just because some things came elevated on.
Yeah, absolutely. I think misinformation is an issue probably because it's been neglected for such a long time. And I guess I don't need to tell you, Brindley, you kind of carry the sword fighting on social every day and every night. So thank you for doing that, kind of sorting fact from fiction and definitely displaying an amazing level of expertise. It's really encouraging. I wanted to actually go back because we get a rare opportunity. And as I mentioned, you are sharing your personal story, but I got to say, and those of us who take care of HS a lot know that this is not, unfortunately, sadly, I should say, not a unique story. And I want to go back to 16, 17-year-old Brindley and ask you, what did you think is going on? Because I always feel that the root to the huge psychosocial issues, or the title we put on this, right, psychosocial, it's basically you feel like crap. And I think one of the roots of this is kind of walking around not knowing what's going on with you. And that is compounded on being a teenager, which is for many of us, you know, you're talking to a nerdy doctor, right? So being a teenager as a nerd is really not fun. So I'm wondering, what did you think? I don't know if you can recall, but what did you think was going on with you? What kind of feelings did that evoke in you? And I know for some people it may sound trivial, but I think that's where the powerful changes occur in your psyche. And that can be a lifelong change. So maybe we can go back to it and share with us, how did it make you feel? What did you think is wrong with you?
That was part of the problem. I didn't know what was wrong with me. I knew something was, but that's where it becomes such a burden to carry and such a secret. You know that your body should not be doing what it's doing. It's obviously there's something wrong, but not having a name for it, or just finding out what the name is, but not being given much information. It's a very shameful thing. You feel disgusting, you feel dirty, you feel responsible somehow for what's going on. And that's one of the other things I would highly encourage physicians to tell their patients. This is not your fault. It is not something you are doing or not doing. You're not cleanly enough. All of these things that we as patients carry, thinking that we have done something wrong to create this issue. And you feel very shamed by that. And it makes you not want to talk to anybody about it, because the feedback you've gotten if you've gone to the doctor up to this point is pretty much you need to lose weight. You need to stop smoking if you smoke. You probably need to work on your nutrition. And like we said, all of these things are very, very difficult and overwhelming to do in normal situations. And then when you add on the pain that you're dealing with, it's difficult. So my 16 or 17-year-old self was very ashamed and constantly on the lookout for, am I leaking? Am I draining? Am I smelling? You know, I mean, it's a full-time job sometimes just to care for your own HS. And I don't think that people who don't have HS can really understand the impact that it has on your daily life.
Right. And I really appreciate, just dawned on me, you said walking around as a teenager or a young adult and just living with a secret. It's a really powerful, you know, so I don't have HS, so it's hard for me a lot of times to put myself in the position of my patients. And I think living with a secret, I'm going to take that away. Thank you. That's really a powerful message, I think, to all clinicians, because there's a person in front of you who's been living with that secret, with that shame for such a long time. And especially in the first visit, when they come to talk to you, there's so many disinformation going around that they have to deal with. And all is that compounded into that 10, 15-minute first visit. And if I can give a clinical pearl from my experience is to try to break it down. I think one of the important tools we have as clinicians is the follow-up visit. And so try to tell the person in front of you that, you know, you've had many years to deal with this. Give me a few months to try to break it down. and do it step by step. There's things we need to take care of first, and then there's things that will come later, and we got to prioritize because it's a lot, and there's a lot of expectation, and there's a lot of anxiety involved in, I need to get better. I need to get better now. Not to mention if you have a family, you have a job, as you mentioned. So I think that can help also to gain a little trust and build a rapport before we start talking about some more sensitive issues like the issue of weight. Is it for you? Is it something that may or may not work for you? As you mentioned, overall, having a healthy weight is a healthy thing in general, but I feel like it may not need to be the first thing we talk about to a person who just been struggling for many years. So thank you for sharing that. Living with a secret. Got it. We talked about the journey and touched a bit on this impact that this has on every patient. So now, what can people do? If I'm a patient with HS, I'm listening to this program right now, how can I be proactive?
I would say make an appointment with your derm and give them some time for sure. We know in the States that there are hoops that have to be jumped through based on insurances in order to get to sometimes a medication that can work. I was just talking to somebody about this earlier today. One of the pharmaceutical companies that's one of the main problems that we have is that in HS, it's at least, like I said earlier, a 3-month trial basis to figure out if something's going to work for you. If you go in as a severe stage 3 and someone throws, a trial of antibiotics at you for 3 months, it's a really frustrating thing. That's something obviously that we can't undertake and fix in the medical system, but it's, I think, important for physicians to know and understand that frustration, because most of the time it already takes us 3 to 6 months to get into an HS expert anyway. And then now you're going to be throwing on some antibiotics that are most likely not going to, it's a needle in a haystack that you're trying to find. It's just not going to work, when you're at that point. So that's a really frustrating process for people to go through. And I think that, like I said, that's not something that we can change, but it's something for patients to keep in mind as well as physicians. We know that we have to jump through some hoops to do this, but to stick it out, because that person is on your side and they really do want to benefit from you getting better. And I also think the other piece to it too is to recognize certain things like clinical trials and surveys and studies, and to encourage people to participate. We see constantly on social media that everybody's like, well, what's going on? How come we don't have a cure? Blah, blah, blah. And it's like, okay, but we all have to participate when these things come up in order for there to be a cure. It's that cart before the horse. They have to see that there's a need and that there's enough people out there to feed that need. And then things come as a result of that. So I think there's a lot of different things that can be done from that perspective.
Brindley, maybe you can tell us about HS Connect.
Sure, hsconnect.org. And we have articles on everything you could ever want to know, and we have still some coming regarding HS. We do a lot of information regarding setting the record straight, getting rid of misconceptions and stigmas about HS that we all come in contact with constantly. And those are the things that keep HS from moving forward. And it's important that we all get on the same page about it so that we have one strong, united voice. We post all of the clinical trials, surveys, studies, anything that's going on that you can participate in. We have a separate section for that on the website. We have an HS handbook. If you're new to HS, it's a great place to start to kind of figure out what you can do. It links to all of our articles. We have treatment journey option articles that are offering things outside of normal regular Western medicine as well. We have an entire nutrition section. So if you're thinking that food may be a trigger for you, I would definitely check that out. We work with a dietitian who also has HS, and she does a lot of working with HS patients on figuring out what their triggers could be. We have a food journal article on there. We have a food journal diary too that you can print off and keep track of what you're eating. So we really have tried to make it accessible to everyone. We also, which is extremely important, have a section for kids and teens. And I am a parent of 2 kids with HS myself. I have a bio daughter who's 15 that has stage 2. And I also have a stepdaughter who is 19 with stage 1, which that just happened out of nowhere. Her grandpa actually had it, so that makes sense. But yes, she couldn't have been, come to a better family. But it's definitely a difficult thing for me to be a parent of kids with HS as opposed to a patient also. I feel like in some way God has given me a little bit of a reprieve right now with my HS so I can help my kids with theirs. And so as a parent, I feel like I also have a lot of things to offer other parents who may not have gone through HS themselves, but have kids with it. So we have an entire section on there devoted to helping out parents. And as a physician, I would also mention one of the things that we found that was really helpful for my daughter was a PE note. So maybe that's something that physicians can think of, asking a parent if that would be helpful, is can I give you a note that your kid can use if they need it in PE? So we had one that just lasted the entire year, and it said my daughter did not have to participate if she wasn't physically able. We also have a letter on there that we have come up with and put together that you can print off and put your kids' information on there and give that to the school about your child may need these accommodations. And as a parent who doesn't have HS, you may not even know that your kid needs those. And sometimes your kid doesn't even know that they need those. So those are really helpful things, I think, that are realistic daily tools that you may not think of. So we've tried to come up with a bunch of information about that too.
And does it cost any money?
Nope. Everything on there is completely free.
There you go.
Yeah. It's all stuff we've put together, just to try to help people through this process and to help them understand what's going on. We have a ton of YouTube videos on mental health, which is another area that's really an issue with HS patients. And, the same thing that people have an issue with is pain. So we do have some articles on there about things you can try for pain. And that really is another thing that we hear in the community as well as being an issue, is because dermatology doesn't really cover the pain aspect of it, it can be a real issue for patients on their quality of life, because these abscesses can cause an immense amount of pain. And some people end up not being able to get out of bed due to abscesses that they have. So, acknowledging the pain that comes with it and the psychosocial burden, I think those things are both kind of more new in the HS realm since it's kind of come back up as a resurgence. So knowing that you're not rare. So HS affects an average of 1 in 100 people. So think about how many people are walking around Costco or Safeway or whatever grocery store you have that also probably have HS. As soon as I came out about my HS in my small circle, I knew 5 people that have HS. So you're not rare. There are people like you all around just hiding the same way you are.
Well, sounds like HS Connect is a treasure trove of information. And Brindley, listening to you speak, I'm not surprised. I know it's a product of love. So thank you for joining us. I mean, you brought so many concepts that I'm writing here. I mean, just thinking of what you can do. We heard you describe how you recruited your support system, right? Family, your boss, and now you're talking about some friends that you shared with. So kind of really building your support system could be a really important thing, because sometimes you do need to go through surgery or maybe spend a few days, even in a hospital in some severe cases. So it's definitely a good thing to have. And then for your psychosocial health, right? To make sure that people understand what you're going through, because that secret that you walk with is so terrible. It sounds just awful. I don't know sometimes what's worse, right? The disease, or just having that secret that you have to carry around from loved ones, from your fellow students, your fellow coworkers, whatever environment you're on. And then you mentioned the issue of helping research, which obviously as a clinical trialist myself, I know Raja is as well. It is so important. I got to tell you, I do clinical trials for various diseases. I have never seen people so cooperative, so motivated like people with HS. If you can make a generalization about these things, I would say that generally speaking, people are really motivated to help, want to get better, but also want to give back. And I think it's fantastic. Because of that, I was just actually looking today, there's a boom of research. I mean, I have to update that slide. The pipeline for HS slide on my HS talk is just never up to date. I just can't keep up with clinicaltrials.gov. It is unbelievable what's happening. It's just like, even if you just look at the drug, forget the surgeries, the all kinds of other treatments and studies. It is booming. And I think that if I may say so myself, the HS Foundation, as a part of that, is also putting a lot of funds into research, and our portfolio is just growing and growing. So I think there's a lot of work there, and that's another thing you hit on. And the other thing you kind of mentioned in passing, which is the issue of coming out, talking about it. It's just a whole podcast in and of itself, but we're not going to touch on it, but it's just fascinating. So perhaps we can have a date to meet in Tucson, not too far from now, and keep this conversation conversation going because it's definitely fantastic. And wherever you can find Brindley, go and find her. I'm sure you can find her on social media through HS Connect. Come to the Integrative Dermatology Symposium and talk to her in person. Whatever you got to do to really take advantage of this amazing resource. Brindley, thank you for joining us. HS Connect is the name of the place to find more information if you're a patient, also if you're a physician. And thank you for joining us.
Thank you guys so much. I appreciate it.
Hey, Raja, do you know where the integrative medicine movement started?
According to Google, since Google knows everything, Dr. Andrew Weil founded the Center for Integrative Medicine at the University of Arizona in Tucson back in 1994. Why do you ask?
Well, you know how we always try to get to the root cause? I think we need to go big for the fifth annual Integrative Dermatology Symposium. How about we do this? Let's meet at the Los Ventana Canyon Resort in Tucson, Arizona. Or you can join virtually from September 30th to October 2nd and hear from the world-renowned experts like Andrew Weil.
Exciting. And our theme is connecting mind, body, and spirit to take a more holistic approach to our patient care. What do you say?
Absolutely. I mean, where else can you get the latest on diet and dermatology, hypnosis, botanicals, common diseases, aesthetics, and other unique topics in dermatology with practical takeaways to start using in clinic right away?
So true. And let's not forget, we've got the new track for estheticians too. I think I'm going to need to call in a sick day or two before the symposium so I can enjoy the waterfall and trails on the resort, stargaze, play a round or two of golf, or tennis, relax at the spa, and catch up with colleagues at the evening receptions.
Yes, that place is spectacular. You know, use our discount code POD25 at checkout for 25% off.